Dr. Shivani. Welcome to Cozmoderm Clinics. Finally, we have Dr. Andrew Christie with us. He's a renowned aesthetic trainer and a master trainer for Microneedling and Dermapen World. He is going to talk all about microneedling, its benefits, and all the little details. Hello, Dr. Andrew. Welcome to Cozmoderm Clinics.
Thank you very much. It's my first time to Nagpur, and it's such a pleasure to be here with you and to spend some time with your audience.
It's a pleasure for us too. Today we'll be doing a short Q&A sessions in which I'll be asking you questions about the indications and the secrets to good microneedling. Why Dermapen 4? What sets it apart from all the other microneedling devices?
Of course, would you believe that Dermapen World are the inventors of automated microneedling? So the history of this goes right back to 2010 in Sydney, Australia.
Yes.
Dermapen 4 is the most recent and the most up-to-date and arguably the most technologically advanced automated microneedling device.
Yes. So in the scars, we have different types of scars like rolling scar, box scars, ice pick scars. Most of us from the experience we know that the ice pick scars are the most difficult to treat. Let's ask him what are his views on it.
Of course, when it comes to scars, we need to understand that there are varying factors which will affect its depth, its appearance, and of course its shape.
Yes.
With the Dermapen 4 technology, we can use a combination of techniques. The first is called gliding, which is more suitable for superficial scars like post-acne rolling.
Right.
But by slowing the speed down on the device and holding it with precision over scars like ice picks and also box scars, we're able to create a very precise scar revision. We then re-support the scar and go in at a second and a third degree angle. And this physically releases the binds, allowing for a faster scar revision and allowing for a faster recovery.
So that eliminates the need for subcision.
Absolutely. The Dermapen 4 device, in fact, goes up to an unprecedented 3 millimeters.
Amazing. How effective do you think Dermapen is for hypertrophic scars? Because we have that belief that something invasive should not be done in case of hypertrophic cases. So what is your view on it?
With a stabilized hypertrophic scar, we're able to use a technique with anywhere up to some 2,000 puncture channels per second, which mechanically revises the hypertrophic scar.
Right.
This is successful if it's stabilized, but for scars which are either unstable or what we often known as keloid scars, we use a drug combination therapy. And this utilizes a specialized steroid solution and an antimitotic solution. And what these do is prevent any growth factor signaling and also prevent any urge for that scar to grow. So the Dermapen is able to successfully revise the scar, but the combination therapy with the drugs are able to flatten and able to create a stabilized and predictable outcome.
So we can treat even hypertrophic scar in combination with few injectables like intralesional steroids or antimitotic drugs. Excellent. Now moving to the next question, how effective do you think Dermapen is for stretch mark and stria?
For a stretch mark, it's very similar to a scar.
Right.
What's different though is a scar, normally the trauma occurs from top down. With a stretch mark, it's a tear of dermal connective tissue. So the source of that trauma occurs from the bottom up. Just as we see with scars, some are going to be indented, some are going to be slightly hypertrophic, but also scars have colors. So for red, blue, and light purple stretch marks, we use the Dermapen to work into the dermis for a mechanical revision, but to instigate the growth of new collagen. For older stretch marks, which generally are going to be white, a very dark purple, or a very dark brown, we treat a little bit deeper down into the hypodermis to promote a revision of the older scar tissue, but to then also stimulate and activate new collagen deposition to create a flatter, fresher, and more even color when it comes to stretch marks.
Great. So newer the stretch marks, they are more easier to treat as compared to the old stretch marks. So if you have old stretch marks, you might need more sessions. Right, doctor?
This is absolutely correct.
Many of my patients who have active acne, when I tell them that they can go Dermapen sessions, they're really surprised that the microneedling device can be used on active acne. What is your view on it?
The thought is that if you microneedle over active acne, that you're going to spread the bacteria from one place to another.
Exactly.
And it's
That's
going to
the
make the
belief.
condition
Yes,
worse.
yes.
But we understand that the bacteria behind the acnes, it's called Cutibacterium acnes, or otherwise known as Propionibacterium acnes.
Right. Yeah.
It's anaerobic, so it lives and thrives in an oxygen-free environment. With the Dermapen 4, we're creating anywhere up to some 2,000 puncture channels per second into the skin, which deliver oxygenation. This forces the reduction of the Cutibacterium acnes, but this in turn then forces the reduction of other associated bacterium, including Staphylococcus epidermidis. The process of activating a controlled wound healing sees a re-keratinization. So in simple terms, what we're enabling is the skin to exfoliate and to desquamate and to remove the clogging and congestion with greater efficacy. So it's a surprising combination therapy, but we can also even use an anabolic chemical peel. This product is called Uber Pro from the DP Dermaceuticals.
Yes.
So your Dermapen is working from bottom up, your DP Dermaceuticals is working within the skin, and the Uber Pro works ingeniously from top down for a triple approach.
Right. Next to acne, the skin condition which commonly comes to our mind is rosacea. When I tell my patients that it even works on rosacea, they are really surprised. Can you tell us how it can work on rosacea and not heat up or make the skin more red?
Of course. With automated microneedling, with Dermapen 4, there's no heat in the device.
Exactly.
There's
no
also
heat
no
energy
ablation.
used. Yes. Okay.
So this creates a safety, particularly for a volatile complexion. For rosacea, we consider that if you can see the patient's tiny blood vessels all the way through the skin, then they have a very thin epidermis and a very thin dermis. So with Dermapen, what we promote is the redensification of the dermis, new collagen, new elastin fibers, but we also instigate growth factors which help to control the blood vessels, which are overgrowing and overdeveloping. We also slow down exfoliation, which in turn helps to refortify the epidermis. So we strengthen the skin, we revolumize the skin and aid the right growth factors for repair and rejuvenation. And this can work for all three forms of rosacea.
Amazing. Now, skin pores, that is a common complaint by most of my patients. How Dermapen can help in that?
Of course. So a dilated pore
Yes.
is a lot like an ice pick scar. So what's happened is there's been an excess oil flow or pressure, which has then expanded the elasticity of the pore and it's unable to bounce back.
Right.
So despite what many people think, pores don't have a muscle. So you can't use toner, you can't use a moisturizer that's suddenly going to bounce the pores back. However, if we use Dermapen with a very similar technique as we do with scars, we're able to refine with brand new collagen. This also promotes the release of elastin, allowing for new elasticity to tighten the appearance of dilated pores, but to even control oil flow, particularly around the nose, the inner cheeks, and the common areas such as the top of the forehead and the chin as well.
Exactly. Pores can be minimized, they cannot be eliminated, and not at all with the help of toners. The best way is to do microneedling. Now, can you enlighten us, other than the scar treatment and pigment treatment, in what other indications can we use Dermapen?
There's so many options. We can work more superficially into the top layers of the skin for treatment of melasma, for treatment of all forms of hyperpigmentation, but even with success for hypopigmentation, where there's not enough pigment within the skin. We can also use Dermapen for milia around the eyes, keratosis pilaris on the backs of the arms, even for intimate rejuvenation. So you can use the Dermapen on full face, scalp, and body. So Dermapen can also be used with combination therapies for
Right.
hair restoration and for forms of alopecia.
Yes, microneedling is a established technique for hair restoration, and Dermapen 4 works excellent on alopecia. Other than that, even Dermapen can be used in hypopigmentary conditions like vitiligo.
Absolutely. So there may be some drug combination therapies from the dermatologist which will be required, but even for common conditions like post-inflammatory hypopigmentation, we can use Dermapen with active ingredients such as retinaldehyde, a form of vitamin A.
Right. Now, how many sessions do you recommend in conditions like pigmentary conditions like melasma or acne pigmentation or tanning, hypermelanosis?
So with these types of conditions, patients need to understand that
Yes.
if the sun or ultraviolet radiation is going to be a key activator, that they must be wearing sunscreen at least 3 to 4 times
Exactly,
a day to
exactly,
support
true.
your treatments. I would say the average patient should commit to at least 3 Dermapen procedures, and then the practitioner will then be able to decide a customized program. This may include the infusion of mesoactives, including the DP dermaceuticals, but also being able to upgrade the procedure with anabolic peeling, including the Uber Pro.
Right. Many of my patients ask me about these at-home use microneedling devices. I myself do not recommend it. Let's hear his opinion.
Particularly with a roller, the
Yeah.
issue is that whilst the needles do penetrate at a 90-degree angle,
Yeah.
as the barrel turns, the needles are going to be arcing and cutting through the skin in many cases, particularly if the patient has a professional sized device where the needles are quite large.
Exactly.
So the risk of this, particularly in untrained hands, is going to be post-inflammatory hyperpigmentation, scratching and tearing on the skin. However, with a device like the Dermapen Home, which is automated and is a clean vertical delivery, and it is very, very superficial, it's designed to enhance the infusion of products like the DP dermaceuticals, but isn't working deep enough to cause any problems within the skin.
Right. So when you are using those at-home devices, you don't know about the needle depth, you are not aware about the needle size, you end up hurting yourself. There might be abrasion and post-inflammatory hyperpigmentation. Whilst with Dermapen, done by a trained trainer or a doctor, there's controlled microneedling and controlled depth, and the safety is assured. Thank you so much, Dr. Andrew.
It's been my absolute pleasure, and a big thank you for all of you who have tuned in with us to learn about microneedling and all
Thank
things
you so
Dermapen
much.
4.
It's been a pleasure having him here for me and my doctors, and we learned so much. Thank you, doctor.
My pleasure.
Nation Next News Hub for New India.